Welcome to HSSC, ATC online training, where we equip healthcare professionals with essential clinical skills to enhance patient care. In this session, we will explore Child Cardiopulmonary Resuscitation, CPR, covering its purpose, indications, required equipment, procedural steps, and key error prevention strategies. Understanding child's CPR. Cardiopulmonary resuscitation, CPR, is a life-saving emergency procedure that combines chest compressions and rescue breaths to maintain oxygen circulation in the body. Prompt and correct CPR improves survival chances until professional medical help arrives. Objective of child CPR: to maintain blood circulation and oxygen supply to the brain and vital organs, to increase survival chances in cases of respiratory or cardiac arrest in children. Chain of survival. The chain of survival in child CPR follows two models: in-hospital chain of survival and out-of-hospital chain of survival. Both models include 6 key links, with the primary difference in the first step. Essential equipment: mouthpiece for safe ventilation, automated external defibrillator, AED with pediatric pads, bag valve mask, BVM, for assisted ventilation, pocket mask for effective rescue breaths. Performing child CPR, step-by-step guide. CAB approach. In 2010, the American Heart Association, AHA, revised the approach from ABC, airway, breathing, circulation, to CAB, circulation, airway, breathing, to prioritize chest compressions. C, compressions, push hard and fast on the center of the child's chest. A, airway, tilt the child's head back and lift the chin to open the airway. B, breathing. If the child is not breathing or gasping, provide mouth-to-mouth rescue breaths. Chest compressions. 1. Ensure scene safety, check for hazards before approaching the child. 2. Assess responsiveness, tap the child and ask loudly, "Are you okay?" 3. Call for help and retrieve an AED. Activate emergency response if the child is unresponsive. 4. Check for breathing and pulse, look for chest movement and air exchange. Locate the carotid pulse by placing 2 fingers in the groove between the trachea and the neck muscle. Assess for at least 5 seconds, but no more than 10 seconds. Compression technique. Use 1 hand for a small child, or 2 hands for larger children, to press down on the center of the chest. Push hard and fast to a depth of at least 2 inches, 5 centimeters. Maintain a rate of 120 compressions per minute. Allow full chest recoil after each compression. Minimize interruptions in compressions. Airway management and rescue breathing. Opening the airway, head tilt, chin lift technique. Jaw thrust technique for suspected spinal injury. Rescue breathing technique. Position a pocket mask over the child's nose and mouth. Ensure a proper seal and deliver 1 breath every 2-3 seconds, allowing chest rise. Reassess pulse every 2 minutes. If no pulse is found, begin chest compressions. Ventilation with bag valve mask, BVM, and pocket mask. Ventilation with BVM. Position the BVM mask over the child's nose and mouth. Use the C&E clamp technique to create a tight seal. Squeeze the bag to deliver a breath, ensuring chest rise. Ventilation with pocket mask. Place the mask over the child's face, ensuring complete coverage. Use both hands to maintain a tight seal. Deliver breaths for 1 second each, ensuring the chest rises. Defibrillation with an AED. Using an automated external defibrillator, AED. Turn on the AED and follow voice instructions. Expose the child's chest and apply AED pads. 1 pad on the right upper chest below the clavicle. The second pad on the left side below the nipple. Plug in the AED connector and ensure no one is touching the child. Allow AED to analyze the heart rhythm. If a shock is advised, press the shock button. Resume CPR immediately after delivering the shock. If the child remains unresponsive, continue CPR and follow AED prompts. Precautions. While using AED, avoid placing AED pads over implanted devices or medication patches. Ensure the chest is dry before applying AED pads. Do not touch the child while the AED is analyzing or delivering a shock. Post-cardiac arrest care. Monitor the child's vital signs closely. Administer oxygen as needed to maintain adequate oxygenation. Keep the child warm and in a recovery position if breathing resumes. Transport the child to a medical facility for further evaluation and treatment. Common errors to avoid. Incorrect hand placement. Hands should be positioned on the lower half of the sternum. Shallow compressions. Ensure adequate depth of at least 2 inches, 5 centimeter. Delaying AED. Use the AED as soon as it becomes available. Improper airway management. Always perform the head tilt chin lift unless a spinal injury is suspected. Hyperventilation. Deliver breaths for 1 second, ensuring chest rise. Key takeaways. Compression rate, maintain 100, 120 per minute. Compression depth, at least 2 inches, 5 centimeter. Single rescuer ratio, 30 compressions to 2 breaths. 2 rescuer ratio, 15 compressions to 2 breaths. Minimal interruptions, maintain continuous compressions. AED use, follow voice prompts for shock delivery and rhythm assessment. Mastering child CPR is critical for responding to life-threatening emergencies. Regular training and adherence to updated guidelines improve response efficiency and outcomes. For more instructional videos and healthcare training, visit our website at www.healthcaresd.in. Thank you.